Hello, I am Dr. Gary Moss at Allergy and Asthma Specialists. In 2009, Duke University published a landmark study on treating children and young adults with peanut allergy with peanut oral immunotherapy. Their protocol consisted of taking these patients and giving them very small amounts of peanut and monitoring them for side effects. When they tolerated these first amounts, they gave them more. And over the course of the day, they gave them as much as they could tolerate. They stopped when the patients demonstrated their first signs of a reaction. They treated the reaction and brought the patients back the next day and repeated as a single dose less than that threshold, and the patients tolerated it. This demonstrated that patients with peanut allergy had a definitive threshold below which they could eat peanuts safely. They then had peanuts continue on this dose below the threshold at home daily for the next 2 weeks. After 2 weeks, they brought them back to the clinic and they gave them a single dose increase. They monitored them, make sure they tolerated it. They sent them home again, and they took it daily for 2 weeks. They continued to do this until they had the patients get up to a dose of 300 milligrams of peanut protein, which they then continued for a number of months. They brought them back into the clinic and they challenged them again to see how much they could tolerate. And most of the patients were able to achieve a much higher dose of peanut. This provided great relief for the patients and their families because they didn't have to be quite so worried about patients having anaphylaxis eating outside of the home. So at school, sometimes they could actually now go to the peanut table, or the table that wasn't peanut free, or they could eat in restaurants without the worry. So we've adapted the Duke protocol, but we've made some minor modifications to it. On the first day, rather than going to the first symptoms, we stop patients at 6 milligrams of peanut flour. The reason we do this is that we have learned, as well as other practices, that the vast majority of patients will tolerate 6 milligrams or more. By stopping at 6 milligrams, we ensure that the patient is unlikely to ever have a reaction during the peanut protocol. The second day they come back and they repeat the 6 milligrams as a single dose. This is a much shorter visit. We monitor patients for 1 to 2 hours, and then we release them to their parents, who will continue to monitor them over the course of the day. After about 2 weeks, they come back and we give them 12 milligrams. And we continue to do this on approximately every 2-week basis until the patient achieves maintenance. We do allow patients to go longer than 2 weeks between visits. Just allows them to fit it better into their schedule. Once they achieve 300 to 400 milligrams of peanut protein, they're able to continue to do this at home for about 6 months. 300 to 400 milligrams of peanut protein is equivalent to 5 Reese's Pieces or 3 peanut M&Ms, but we often use other peanut products. We like to use whatever the patient prefers. At the end of approximately 1 year, we bring the patients back and we challenge them to a peanut again, this time to see how much they can tolerate. We actually have 2 different challenge protocols depending on whether the patient likes peanut or not. If they like peanut, we try to challenge them to a coarse serving, which for a young child is about a half a PBJ, about 15-16 grams of peanut, and an older child and an adult a full PBJ, about 30-32 grams of peanut. For patients who don't like peanut, our goal is that they will tolerate at least a bite, because if they don't like it, they're not going to eat more than 1 bite. For those patients, we like to see if they can tolerate 4 grams of peanut. We have 4 goals of peanut therapy. The first is that the patient can tolerate trace peanut protein. No one ever defines what trace peanut protein is. We assume it's somewhere below 25 to 50 milligrams of peanut protein. So once a patient is eating that on a daily basis, we're not so concerned about them eating out at restaurants or going to the regular parts of the cafeteria away from the peanut-free table. The second goal is they can tolerate their first bite. They bite into something, realize it's peanut, and they stop eating it. The third goal is the big goal, is that they can actually introduce peanut into their diet. We've had many patients who are eating peanut on a regular basis without restriction. Now, there have been some studies where patients who have been on peanut therapy for short periods of time, and when they've come off of it, they've lost their tolerance. So we tell every patient that we anticipate that they're going to be taking peanut on a frequent basis indefinitely to maintain the tolerance. We hope that these patients become fully tolerant like a regular person, that they don't have to eat the peanut to remain tolerant, and we might be able to achieve this one day. At the moment, we don't have a good way of determining who's achieved this goal, so we anticipate everybody who's doing this does maintain frequent peanut in their diet. I hope we can answer any further questions you have in our office. Thank you.